Hello and namaste, everyone. My name is Ashvini, and I am a qualified public health promoter for ASHA services here at Asian Family Services. And today joining with us is a health and disability advocate from Nationwide Health and Disability Advocacy Service, Pranesh Davendra, and he will be sharing with us some of the information about consumer rights while accessing health and disability service here in New Zealand. So welcome, Pranesh.
Thanks, Ashwini. Thanks for having me here today. Before we start, just want to sort of explain what Health and Disability Commissioner Act 1994 means just in a nutshell. So the Act says consumer has rights and providers have duties. Health and disability advocate like myself, we are not investigators or mediators. We assist consumer to raise a complaint with a provider. And this could be just basically providing them the information about Code of Rights or drafting a letter for them and being actively involved. We have 23 community-based services or offices around the country serving the communities. Towards the end, I will provide the 0800 number and the advocacy website address for your clients.
Okay, thank you, Pranesh. So we will start with you briefly on explaining the 10 Code of Rights we have here in New Zealand.
The consumers, while accessing health and disability advocacy services in New Zealand, has 10 rights: respect, right to be treated with respect, fair treatment, right to be treated fairly without discrimination, dignity and independence. The services should support a consumer live in a dignified or independent life. Communication, the information should be provided in a language that's easy for consumer to understand, and if required, communicate with the provider to clarify things. Information, the conditions need to be explained to a consumer, and also what are the choices that is available for them. This information can range from estimate cost of a procedure, the names of the providers providing the information, the availability or the wait time of a procedure. In New Zealand, people are encouraged to ask questions. Decision, the consumer has the right to make a decision on their care. They can say yes, no, and change their mind anytime. Support, the consumer has the right to have someone to support them throughout the process or consultation. And in most circumstances, they can request to take a support person with them. Teaching and research, whatever rights that I have explained earlier needs to be applicable if a consumer agrees to participate in a research project. Last one, the complaints. The Act says the consumer has the right to complain and have their complaints taken seriously. No one should treat consumer differently if they do end up making a complaint. These are our 10 rights, yeah.
Okay, so Pranesh, we will start with some of the questions and concerns that have been brought to ASHA services regarding accessing health and disability services. And one of the questions would be, Pranesh, can a consumer refuse a treatment if they are not happy with the information provided by the GP?
Yes, the consumer can refuse a treatment. And request a second opinion from a doctor or a specialist. The consumer can also ask for alternatives that are available before agreeing to a treatment.
Okay, and in addition to that question, can a consumer be forced to receive a particular treatment or medication that they are not comfortable with taking?
No one can force a consumer to receive a treatment or medication. The doctor is required to explain the risk and benefits of a treatment or medication to ensure the consumer is fully informed of what's going on. No one can force, so The treatment or medication cannot proceed without a consumer's consent. When a consumer says stop, the provider has to stop. However, there's another scenario. If a consumer, especially in life death situation, are unable to give consent, the provider can proceed with treatment or medication if a intervention is necessary, unless they know the name of the next of kin or are aware who holds the enduring power of attorney or has the welfare guardian.
Okay, so they definitely do have the right to refuse if they were not happy.
Definitely,
Okay,
definitely.
all right. Okay, that's good to know. And in case if a consumer feels judged by the provider, what can they do?
The consumer can raise a concern directly with the person involved. Right one very clearly says that you have to be respected. No one in New Zealand should be judging you while providing health or disability services.
Okay. And another question would be, Pranesh, we as consumers are really concerned regarding our privacy. So in terms of privacy, how do providers reassure their patients with whatever information that they give will be kept private and confidential? And in case of a breach of privacy, what consequences are there for the provider?
Most providers here in New Zealand are obligated to protect the customer information under the Privacy Act. So the Privacy Office, the Commissioner, Privacy Commissioner, promotes and develops processes to respect personal information and how it should be protected. A consumer has the right to ask the provider how their information is stored and who has access to this information. A reasonable provider should not have a problem with this and should welcome this question. Should a consumer feels that their information is not being handled appropriately or has been interfered with, they can approach the Privacy Commissioner. Their office will assess the complaint and make a decision whether full investigation is required.
Okay. And in terms of receiving a biased or culturally inappropriate, say, comment while undergoing a treatment, what can a consumer do in that situation?
The consumer can approach the patient directly and try to understand why such comments or actions were taken. If the matter is not resolved, they have got the right to request their internal complaint process and then make a complaint internally. And they can do this on their own. But if they are for some reason worried or intimidated, then they can contact an advocate and we will support them navigate this complaint process as well.
Okay. And in terms of making that complaint, is there a particular time frame that the complaint needs to be lodged within?
There is no specific timeline. However, a provider can come back to us saying that the incident has happened too long ago. The named person or parties are no longer practicing or has moved abroad and they do not have access to records to assist us with. It is very important to note in a complaint a specific timeline, accurate timeline, I should say, the summary of events, the key issues, and the outcome that you are seeking. A simple template of the complaint is on our advocacy website.
Okay. And if they have made the complaint, like you said, within the time frame or whenever they have had the time to make the complaint, and they have not received a response back or a feedback from the provider, what can they do and who can they contact then?
Right 10 very clearly says that a complaint has to be acknowledged in writing within 5 days of the receipt unless it's resolved. Providers in New Zealand have different complaint procedures. Generally, within 14 to 20 days, a consumer should receive a response. If the provider needs more time, the good practice is to contact consumer and explain that they need more time and provide a timeline within which they will provide a response. Should a provider fail to engage during this complaint process, the consumer has the right to approach Health and Disability Commissioner directly. But if they need an advocate support, we are available to support them through this as well.
Okay. Lastly, what sort of support is available through your services, Pranesh, and how can people contact you?
I assist consumer resolve their complaints by providing advocacy service that focus on a resolution of their concerns and complaint. I promote healthy relationship amongst parties. I educate both providers and consumers on all aspects of Code of Rights. They can contact me through our 0800 team. The number is 0800 555 050 and request one of our team members to speak to Pranesh Davendran. Alternatively, they can contact ASHA team and request my email address. The role of the health and disability advocate in our organization is available through advocacy website www.advocacy.org.nz. Thank you.
Thank you, Pranesh, for sharing that information. It was really beneficial to hear about all the support that is available through your service. And like you said, definitely people can contact ASHA Services, which is a support service for our South Asian community living here in New Zealand. And it is a free and confidential counseling service for anyone who is impacted by harmful gambling. This could include the person who is gambling or a affected other. So if someone is affected by a family member's gambling or a friend, yeah. And alongside our gambling support, we also provide emotional support, and we also provide general information, for example, how to navigate through New Zealand's health and social system. And yeah, so if you require any support, please contact our Asian helpline on 0800 862 342 and press 6 for Hindi if translation is required. And we are open from Monday to Friday from 8:30 to 5 p.m. for a confidential chat. Thank you.